The past 2.5 years have been hard on everyone, but essential workers have borne the brunt of the burden. And that includes pharmacists who've been putting themselves at risk to keep their communities healthy, with many expanding their services to include COVID, testing, and vaccines while dealing with widespread staffing shortages. These conditions are not only stressful and potentially dangerous for pharmacists, they're dangerous for patients too. More than three-quarters of pharmacy workers say they don't have enough time to do their responsibilities, including patient care and clinical work, safely. According to a recent survey from the American Pharmacists Association and the National Alliance of State Pharmacy Associations. I'm joined now by two leaders of the Massachusetts Association of Pharmacists, Saad Dinno, the group's current president, who's also a registered pharmacist, and the president of Dinno Health Pharmacies, and Ryann Abrams, the group's president-elect and manager of pharmacy operations at Rite Aid. Congratulations to both of you for incoming and outgoing, first of all.
Thank
Saad,
you.
I want to start with you, Saad. Just talk about what the stressors have been for pharmacists in general over the past 2.5 years during the COVID pandemic.
Sure. Thank you so much for having me. I think one of the number one stressors has been trying to keep up with current aspects of COVID because the last 2.5 years we've done with COVID. Um, it started by doing masking, and then starting by making sure that we have the right aspects of our pharmacy covered, so the interaction between patient and our staff is at minimum, distance wise, was abiding by the current guidelines. um, and then and then after that, I think we my especially for me, from owning four independent pharmacies, my 70 plus staff were absolutely tremendous. Every single one of them stepped up to the plate whenever needed, and thankfully we survived the hardest times of COVID. But now with Omicron, since September, November, December time period, things have changed a bit from a staffing perspective. But I think the stresses was just trying to keep up with the current CDC guidelines, trying to have the most absolute, correct information in front of us to provide our clients and customers. And then, and then on top of that, just trying to do the daily aspects that we do as pharmacists and pharmacy staff on a daily
Right,
basis.
Ryan, I want to back up a little bit and go pre-COVID to chat with you. In my household, we have a number of people with chronic illnesses, and I think we have some 20 prescriptions that we have to get filled on a regular basis. We go to a chain pharmacy in our neighborhood. I live in Boston. There's multilingual, multi-languages and needs that our pharmacist has to address. Before COVID, I was always in awe of how the two or three pharmacists I know worked there had so much work to do, and how the staff did. A shout out to Marie at CVS in JP, how hard they all worked at trying to arrange things. What was the situation for pharmacists and staff going into the pandemic? Were they as stressed as it seemed to me, although excellent but stressed?
Yeah, I mean, pharmacists have been remarkable throughout. Their pharmacists are not strangers to working hard, to the physical aspects of the job. I mean, those physical demands. You're on your feet. You have a lot of moving pieces in any given day in a pharmacy. So pharmacists prior to the pandemic were no strangers to the physical demands, no strangers to the mental demands either. I mean, they're constantly thinking about patient safety. That's always forefront in your mind, getting to know your customers and your patients, and making sure they have what they need. So that didn't change. The biggest change that I think COVID brought was that emotional piece. We've always had those emotional connections with our patients and our customers, but there was just so much more because, we had that much more of a need. People that were coming in that we had never seen before, asking us for advice and for recommendations, if they were sick, if they were healthy. We were seeing it all. So that was a big change that happened, just that emotional piece. I mean, there was a lot of stress. Patients brought that in to the pharmacist. They had a lot of questions. There was, sometimes some anger, sadness, and we were dealing with all of it. So combine it all together was really, a tough combination, but pharmacists were remarkable. They were resilient and steadfast, and really, just going into the stores and you know that the world has changed outside, where everything got flipped upside down in a minute. And then you would walk into the pharmacy and it was like nothing had changed. Maybe a mask,
Yeah.
but they were still there just doing their jobs, getting it done. They were there for their community, they were there for their customers and their patients, and it was remarkable. And I'm so proud of our pharmacists. I work for Rite Aid. I'm
Mhm.
proud of our pharmacists at Rite Aid, but all the pharmacists that just continue to um, keep on going throughout.
So
It's amazing.
I witnessed actually at my pharmacy a sort of game of telephone in translation between one of the pharmacy workers, the pharmacy technicians, the pharmacist, and a client, a customer who was had some mis or disinformation about COVID and was asking questions at a very busy time where they were carefully and patiently explaining, get the vaccine, you need to get the vaccine. I think Ryan has touched on this a little bit, but what's the toll that all of this has taken on pharmacists, and why should we as customers be concerned about it?
Well, so we've handled. I think if you ask any of my staff members, Sue, is probably number one complaint from them is the amount of phone calls that we've handled over the past 2 years, and it's all because our customers are looking for us as accessible healthcare providers, as pharmacists, very accessible to our communities and our staff, to our community and our customers and patients. It's just answering all those phone calls one after the other, especially when it came to vaccines and scheduling and et cetera, et cetera. Um, like I said, I mentioned before, on top of taking care of our daily aspects of taking care of our patients that rely on our services on every day, that added a lot of stress. That added, I think I was, checking on more of my staff than any time I've been a pharmacist for 30 over years and the owner. And, I kept checking on them every day because I was concerned about the stress level that all these phone calls, all these extra work has caused. And, like I said, they handle it with an amazing, efforts and assistance, but you can see on their face that it gets tiresome a little bit after a while. But we
So
had a mission, and that was to take care of our patients.
So Ryan, it was news recently when one of the chains made an announcement that the pharmacy was going to be closed between noon and 1 so that the staff and the pharmacist could take lunch. And that was a little shocking to me that actually had to be something that was done. It just wasn't happening naturally that a pharmacist who's got a very high stress job with a very low level, low ability to make any mistakes had to make sure that they were protected for lunchtime. What are you and the Massachusetts Association of Pharmacists, what are you looking for, or are you looking for changes or accommodations during this period to both help the pharmacists and to keep their accuracy at the high level that it usually is?
Yeah, I mean, workplace safety, patient safety is certainly on the forefront of our mission and what we want to do as an association. We represent pharmacists and pharmacy professionals throughout the Commonwealth and that work in all different settings. So, although your community pharmacist is probably your most visible pharmacist, pharmacists exist pretty much in every aspect of healthcare, in hospitals and clinic settings, in independent practice, consulting, long-term care. So, pharmacists work in a number of different settings, and we represent all of them. We want pharmacists to be able to, use their expertise and what they're trained to do and work at the highest level of their license. And so to do that, we'll certainly advocate for laws and legislation that will allow pharmacists to do that. Those top of scope activities. Every pharmacist I've interviewed, we want to help people. That's really what we want to do. And sometimes we need those rules and regulations in place to allow us to do that safely and effectively.
So it's as difficult as the past years have been. I know that Dr. Anthony Fauci was on with Jim and Marjorie on Boston Public Radio today, and we have talked about the Fauci effect, right? That there have been a number of people, young people coming out of high school and college who have decided to choose a career in medicine because of what they've seen in the inequities and challenges that COVID has exposed. Are you seeing more interest, a greater demand of young people and individuals who are choosing to go into the pharmacy practice or get their pharmacy degree? As college enrollment up in that world?
I mean, in general, the enrollment of pharmacists is somewhat at a plateau right now, Sue. So, but speaking of I had a high school student today start a 3-week internship from a local high school because she's interested in pharmacy. So, the pharmacy has always been a profession where, again, as my colleague Ryan mentioned, we're here to help patients and customers. That's our number one mission. A lot of these young individuals come, ask us and, come in and interview us as to why we are a pharmacist, and they're baffled as to how much interaction we have with patients and how much accessible we are to the customers. And it's an incredible profession. We have some issues to deal with, in regards to work aspects and long hours, and dealing with a payment model that's probably not sustainable for the future. But it's a great profession. A lot, my son is graduating as a 3rd generation pharmacist next, in a couple of days from pharmacy. So, there's a lot of young men and women that have chosen this profession, which is an absolutely great profession in health, and healthcare providers is what we're after, and we deserve that status.
Ryan, what can we do as customers? I mean, or as the folks that are on the receiving end of the gifts and skills of the pharmacists and their and the technicians and everyone working behind that plexiglass. What can we do to help? Or I know we should be checking our pills and reading the instructions and asking questions, looking at the pills to make sure they're the right pills that they are on the description. But when it just comes to the actual interaction with the pharmacies, what can we do to be better community members?
Well, we're there to help our community. I think it's great when community values their pharmacist. So I would just say continue to value what your pharmacist can provide. Continue to be a champion for those services that that the pharmacist is giving their customers and their communities. Whether it's going out and doing flu clinics or going to schools and local businesses and organizations, we really are interwoven into the fabric of our communities. So I would just say, value what your pharmacist can do. Know that we do so much more than just dispense pills. I think that's the biggest thing, is to know that we're capable and we do so much more. Our jobs are important. And then if there is any legislation or action supporting pharmacists, we hope that you can support that in that respect, because that'll be a big piece of evolving our profession and moving it forward.
Saad, I'll give you the last word. Do you have anything to add to that?
Well, I think we hear from our customers all the time, and Sue, you being a customer as well of a pharmacy, is that I'm going to call you first. I'm going to try to get the answer from you first before I contact my other providers, because I know I could reach you. I know I'm, potentially, if you don't know the answer, you're going to get the correct, you're going to search it for me. I just tell the consumers and customers, ask questions. Don't leave a pharmacy without knowing what your medication is all about. Know the interactions, know the side effects, et cetera, et cetera. That is our job as pharmacists. That's why we went to school. We know medications. We're the experts of medications. Please ask questions. Don't hesitate. That is why we're there. That's why we are there for you, for our consumers and customers in our communities.
Saad Dinno, Ryann Abrams, thanks so much, and thanks to all of the pharmacists who have been doing the hard work over the past 2.5 years and beyond and forward. Thank you so much for joining us today.
Thanks
for having us.